Every day, many Americans wake up worrying about the mental health of a family member or loved one. An estimated 47.6 million adults in the U.S. experienced mental illness last year. That's 1 in 5 adults in this country. This morning, we're announcing an upcoming special show to address this urgent issue.
CBS This Morning will broadcast a live town hall, Stop the Stigma, a conversation about mental health. That's on October 23rd. We'll feature a live studio audience of people affected by mental illness in various ways. Dr. Sue Varma is among the experts who will participate in the town hall. She's a fellow of the American Psychiatric Association, one of the many organizations we're consulting with for this special show. And she joins us now. Sue, thank you for being here.
Thank you for having me.
So stigma and mental health. These concepts are intertwined, and they shouldn't be in this country. What is the impact of stigma on people's ability to get the help they need?
Yes, it is very detrimental. Stigma is about lack of education, lack of awareness, and sometimes even when people have both, it comes down to a lack of compassion and empathy, right? So we have an understanding, but what are we going to do? How is it going to translate into action? And that's what we need. We need action. We need people on every level to understand that not getting the help that we need only makes the problem worse. When we have stigma, we are creating shame and we're creating blame. Would we blame somebody for having type 1 diabetes? No, absolutely not. Would we blame somebody for having the flu? Would we blame someone for having a broken arm? This is no different.
So you say blame and shame gets you nowhere, but yet it exists. Why? Why do you think that there's still, after all this time, and so many well-known people have come out talking about it. People have members in their family who also suffer from mental illness, yet it's still there. Why?
We don't think of the brain as an organ. When we see somebody's behavior, we think that they have the capacity to change. But the reality is that a lot of times people are not even aware of the symptoms that they're having half the time, right?
Yes, right.
And we need to know, what are those symptoms? Somebody says, just snap out of it. If you had a 103-degree fever and you were suffering from the flu, how effective is it if your family member said, snap out of it?
What are some of the most significant stigmas that we still have?
Yes, that we think that somebody can change if they're drinking, if they're abusing substances. We think that this is some moral failure, that they didn't try hard enough, right? But you know, one thing that's interesting is when people die by suicide, if we were to think of it as somebody dying by cancer, how would it change, right?
Yes.
Like the person didn't want to live. And that leaves, anytime you have a mental illness or you have suicide, it affects not only a family, a society, a community. People who are left behind feel like failures. People who are experiencing it feel like failures.
So talking about it the way we are now, that helps break down the stigma. But what else can we do? The science is clear. The health ramifications are clear. How do we break through to really change this system?
I think it's so important that people who are celebrated in our community, who are seen as very strong, if they're able to come out and share their struggles, as we have seen, we see that this can be a part of a normal person's life. If we're talking about 1 in 5 people, we look around the room right here, all of us are struggling with something at some point in our lives. So normalizing it, and people who we put on pedestals, who are our heroes, they need to come out. We need to also be open when we're struggling with something. We need to shed a positive light. If you're going to share with your friend the best restaurant that you've been to, why can't you tell them the best therapist that you've ever been to? Talk about the positive experiences of getting help. Focus on that aspect.
And struggling with things like what? Because you hear mental illness, and that's a very big brush.
Yes.
So mental illness, struggling with what, for example?
So, for example, if you're dealing with what we call major depressive disorder, somebody is saying that I have difficulty getting motivated. I don't want to get out of bed. I've lost pleasure in the things that I once used to. I'm finding that I'm gaining weight. I can't concentrate as much. I'm feeling very anxious. I'm paralyzed. I'm ruminating. I'm having difficulty making decisions. Or somebody says I'm having fluctuations in my mood. If they're talking about bipolar disorder, sometimes I feel like I'm very elated. I feel like I have periods in my life when I have episodes when I can get a lot of work done. I feel grandiose. I feel like I can buy a lot of things. I'm buying things in different colors and making impulsive decisions.
Isn't it true, though, that sometimes people don't recognize that this is a problem?
Yes, we don't know this is a problem because they think, where's the difference between going back to a baseline if you're coming out of a depression and you're going into a manic episode?
We need to recognize it, and we also need to talk about it. Dr. Sue Varma, thank you very much. The conversation starts now, and it's going to continue. CBS This Morning special live town hall, Stop the Stigma, a conversation about mental health, will air October 23rd, and look for continued coverage in the days leading up to the show and after as we call attention to this important topic.
And Sue Varma will be back on that day. Look forward to seeing you again.
Thank you.